1. Which principle of adult learning emphasizes that learners bring prior experiences into occupational health education? A. Pedagogy. B. Andragogy. C. Behaviorism. D. Constructivism. 2. What is the most effective method to evaluate the success of a workplace safety training program? A. Counting attendance. B. Pre- and post-training assessments. C. Reviewing training materials. D. Observing trainer delivery. 3. In developing a health education curriculum for workers, which step should come first? A. Selecting teaching strategies. B. Defining learning objectives. C. Preparing evaluation tools. D. Designing handouts. 4. When mentoring a new occupational health nurse, what is the most important skill to model? A. Strict adherence to written policy. E. Effective communication with employees. C. Speed in completing paperwork. D. Limiting interactions with management. 5. Which communication strategy best promotes behavior change among adult workers? A. Passive listening. B. One-way lecturing. C. Motivational interviewing. D. Technical jargon. 6. A COHN is tasked with ensuring OSHA compliance. Which action is most appropriate? A. Conducting employee focus groups. B. Performing regular workplace audits. C. Hosting a team-building retreat. D. Surveying employee satisfaction. 7. Which evaluation method measures long-term outcomes of a wellness program? A. Immediate knowledge quiz. B. Exit interview. C. Health trend analysis over time. D. Attendance count. 8. When designing curriculum for occupational hazard prevention, what should guide content selection? A. Nurses' personal interests. B. Employers' advertising needs. C. Identified workplace risks. D. Textbook availability. 9. A new nurse struggles to complete regulatory paperwork. As a mentor, what is the best approach? A. Provide the completed forms. B. Criticize their inefficiency. C. Demonstrate and explain step by step. D. Ignore and let them learn independently. 10. Which adult learning principle stresses practical application? A. Self-directed learning. B. Abstract memorization. C. Passive reception. D. Authoritarian instruction. 11. A key role of the COHN in communication is to A. Act as a liaison between employees and management. B. Replace human resources. C. Manage financial records. D. Approve all hiring. 12. In evaluating an ergonomic training program, the best outcome measure is A. Number of chairs purchased. B. Reduction in musculoskeletal complaints. C. Trainer satisfaction survey. D. Cost of training materials. 13. Which mentoring technique helps new nurses develop critical thinking? A. Giving them all answers directly. B. Asking reflective questions. C. Assigning unrelated tasks. D. Ignoring mistakes. 14. A nurse develops a curriculum on chemical exposure. What ensures regulatory compliance? A. Alignment with OSHA standards. B. Use of colorful slides. C. Employee voting on topics. D. Short training sessions. 15. Which is the most reliable evaluation method for a hearing conservation program? A. Self-reported surveys. B. Audiometric testing. C. Attendance sheet. D. Classroom quizzes. 16. An adult learning strategy that incorporates problem-solving activities is A. Simulation exercises. B. Passive reading. C. Memorization drills. D. Instructor monologues. 17. A COHN, reviewing HIPAA policies, is focusing on which regulatory area? A. Environmental controls. B. Confidentiality and privacy. C. Ergonomic adjustments. D. Hazard communication. 18. When providing feedback to a mentee, which is most effective? A. Criticizing publicly. B. Offering specific, constructive suggestions. C. Avoiding feedback. D. General praise only. 19. In curriculum development, objectives should be A. Broad and vague. E. Measurable and specific. C. Based on textbook chapters. D. Determined by convenience. 20. The best way to encourage active participation during training is A. Provide real-life case studies. B. Use only long lectures. C. Limit opportunities for questions. D. Focus only on memorization. 21. What ensures accuracy in regulatory compliance training? A. Annual review of updated standards. B. Relying on outdated manuals. C. Skipping revisions. D. Using only local guidelines. 22. A COHN implementing a smoking cessation program should first A. Analyze employee smoking data. B. Design flyers. C. Create certificates. D. Skip assessment. 23. Which evaluation method best measures changes in behavior after training? A. Observation on the job. B. Written test immediately after. C. Trainer's impression. D. Number of training handouts given. 24. The primary focus of mentoring in occupational health is A. Building clinical judgment. B. Limiting responsibility. C. Avoiding challenges. D. Memorizing manuals. 25. When developing health education, what principle respects adult learners' autonomy? Allowing them to set personal goals. B. Dictating all activities. C. Providing no choices. D. Avoiding feedback. 26. To comply with ADA regulations, training materials should be A. Accessible to individuals with disabilities. B. Written in complex language. C. Limited to paper only. D. Presented only verbally. 27. In evaluating communication effectiveness, the best indicator is A. Employees demonstrate safe practices. E. Trainer enjoyed the session. C. Number of slides shown. D. Room temperature during training. 28. What is the role of formative evaluation? A. To improve program while in progress. B. To certify final outcomes. C. To summarize financial costs. D. To replace summative evaluation. 29. Which adult learning method works best for teaching proper lifting techniques? A. Demonstration with practice. E. Reading regulations only. C. Long theoretical lectures. D. Silent observation. 30. A mentee asks how to handle confidential employee health information. The mentor should A. Teach HIPAA compliance principles. B. Share information freely. C. Ignore the question. D. Refer to non-health staff. 31. A curriculum must include evaluation tools to A. Measure achievement of objectives. B. Replace course content. C. Entertain learners. D. Increase paperwork. 32. Which communication technique fosters trust with employees? A. Active listening. B. Frequent interruptions. Here as perspective on paid primary goals. Never happen in perfect harmonies. C. Dismissing concerns. D. Using technical jargon. 33. A COHN ensures compliance with bloodborne pathogen standards by A. Conducting annual training. Reducing class sizes. C. Ignoring minor exposures. D. Using outdated forms. 34. Which type of evaluation measures immediate knowledge gained? A. Post-test. B. Health surveillance. C. Injury rate analysis. D. Employee absentee report. 35. In mentoring, what is the primary role of the mentor? A. Guide and support development. B. Do all work for mentee. C. Avoid interaction. D. Criticize errors harshly. 36. Which adult learning strategy emphasizes reflection on experience? A. Debriefing discussions. B. Memorization drills. C. Reading long texts silently. D. One-way lectures. 37. A nurse develops curriculum on PPE use, which ensures relevance. A. Tailoring to specific workplace hazards. B. Using generic examples only. C. Limiting to textbook definitions. D. Avoiding employee input.